friends, I'm Dr. Molly Brinkman. I'm a veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. Welcome to the Dr. Molly Says podcast. How's everybody doing? It is December. December is raging on, and Christmas is what we celebrate in our house, and it is coming fast, and I am not ready, but here we are. I hope you all are surviving out there. I hope the parents out there, solidarity. We are going to talk about some current events today in the animal and veterinary world. So I'm sure that many of you have heard about at least one of these things. And one of them is a horse topic, which if you're new here or you haven't heard me talk about it, I was actually a horse veterinarian, an equine veterinarian, and other large animals before I did all small animals. So I worked in Western Colorado as an intern at a surgical equine practice first after vet school, and worked on cows, llamas, alpacas, pigs, sheep, goats, you name it when I worked there, and did a lot of ambulatory practice, but lots and lots of horses. So I grew up riding horses. I still ride horses when I can. I love horses, and this is a big deal in the horse world right now. So we're going to just get right into it. No hot take today. So equine herpes virus, if you've heard about this on the news, several people have asked me to talk about it, so I'm happy to do that. So if you've never heard of equine herpes virus, there are several types of herpes virus that can affect horses. One of my favorite professors in vet school, Dr. Melissa Kennedy, she's passed away. It's very sad, but she's a very funny, very brilliant woman. And she used to say, all God's children got herpes virus. So most species develop some type of herpes virus or can be infected with herpes virus, but it does different things in different animals. And in horses, there are different types of herpes virus that they can be infected with. There is an outbreak right now of EHV-1, which is equine herpes virus 1. 1 and 4 are the two that are most likely to cause illness in horses. And 1 is the big one because it can cause some really serious things. It's very contagious. It's a herpes virus that infects usually the respiratory tract. So that's where it attacks, but it can also spread and cause major problems in the nervous system and in the spinal cord and the brain. And so that's why this one, EHV-1, is one that horse people, sorry, my pillow's getting on my nerves. EHV-1 is scary for horse people because it can cause a neurologic disease called equine herpes myeloencephalopathy, which is a very devastating disease. I have seen it, and it's terrible. So herpes, another thing Dr. Kennedy says is herpes is forever. So just like many species and animals, once they're infected or exposed to herpes virus, that virus can go dormant or latent in their system. So they're technically harboring that forever. And this can be a contributor to outbreak situations. Okay, so how does equine herpes virus infect a horse? So again, this is a virus that enters a horse's system usually by inhaling respiratory droplets or nose-to-nose contact. Okay, so the respiratory system is usually how this is going to come into contact with the horse. And in respiratory epithelium, the virus is going to replicate. Okay. Once the virus replicates enough in the respiratory epithelium, respiratory system, you can end up with viremia, and the virus is traveling via leukocytes, white blood cells, and getting to other places. And so in some infections, this can lead to vasculitis and thrombosis in the central nervous system. So basically what happens, the virus reaches vessels in the spinal cord and the brain, and this is what leads to the myeloencephalitis, which is I'm sorry, not encephalitis, myeloencephalopathy. See, I can't even keep all the words straight, which is the neurologic version of this in horses that is very, very devastating. So, not only can it affect the respiratory system in horses, the central nervous system of horses, it can also infect the placenta in pregnant horses. And so, this can lead to late term abortions. So, obviously, in the horse world, viruses that cause abortions or loss of pregnancy can be very devastating for breeding operations as well. So, when we talk about horses with EHV-1 in the respiratory version of this virus, horses can recover from it. But if it becomes EHM, the herpes myeloencephalopathy, this can be very devastating, very expensive to treat, and deadly. So, clinical signs of equine herpes virus 1 in horses in the respiratory version, these horses will develop a fever. They can have a cough. They'll often have nasal discharge. Horses with respiratory disease are often just really lethargic. So, they can be breathing hard. And sometimes we can see that. A lot of times, the first thing that horse owners will notice is nasal discharge. And they can go off feed. They don't want to eat because they just really don't feel good. In the neurologic version of this virus, EHM, these horses can become ataxic. So they're moving very wobbly. They seem like they don't really know where their legs are. They can be falling over. They can have just weakness in their hind limbs. Sometimes we see what's called a dog sitting posture, where they're actually like sitting on their butt and their front arms are kind of extended out, and they can have urinary retention. And in severe cases, they will become laterally recumbent, just down and neurologically inappropriate. These horses can get really sick and really abnormal really fast. And then, like I said, if a horse is pregnant when she becomes infected, this can cause abortions and foal death. So again, transmission happens from nose to nose contact, obviously, sharing equipment, water buckets, feed buckets, horses and trailers together, just horses in close enough contact to inhale respiratory droplets from each other. Often human assisted spread happens. So someone who's handling a horse who's infected then goes and handles another horse. They can actually transmit the virus. And horses who have been infected or exposed to the virus get over it, but the virus is latent in their system. They can have what we call stress induced reactivation, where stress from travel or another illness or whatever causes that virus to rear its ugly head. So, horses with this virus can be treated in different ways. For the respiratory and neurologic patients, there are supportive care measures that are taken. So, NSAIDs can be used to help with fever, fluids for support, other ways of just giving them supportive care. There are some thoughts of giving antiviral treatment. Valacyclovir is one that can be given early on. I am not up to date in the equine world, and so I don't know if that's really being done very often. In neurologic patients, they require really intensive care, intensive nursing. Horses do not do well if they can't stand. And so if they're so ataxic or so weak that they can't get up, that is a major problem for them. And all of these horses with this disease have to be very strictly quarantined. If you've never been in an equine hospital sort of situation, uh, big equine veterinary hospitals will have isolation stalls. If you've ever worked in equine medicine, if you've ever been an equine intern, you know that the isolation stall is the bane of your existence. And I know that with what's going on right now, I really feel for the equine interns out there, because I know that y'all are gowned up, booted up, in an hot or freezing cold, steamy isolation stall all the time. So these are stalls that are usually away from the other stalls in the barn, in a treatment or hospitalization barn. And they're like solid stalls, like an actual room with special ventilation, because it's supposed to contain virus. And in a virus like this, that's why that's important, because it's spread by respiratory droplets. So you want to keep everything that horse is putting out in that room. And so everything that happens in that room has to be done very carefully. Veterinarians who are treating patients in isolation stalls, horses, they gown up and they have to go in there, do all these things in a certain way, and then take all this protective gear off. And they're in there alone. And it's just not fun for anybody. But it's how we keep other horses safe. This puts horses that are sick with other issues, horses that have just had colic or whatever, that are in the hospital. When these types of horses they're isolated, at risk, because we do our best to control virus and keep it contained. But sometimes that isn't always successful. So horses with equine herpes virus can recover. It is much more likely in respiratory cases. The prognosis is significantly poor in neurologic cases. Sometimes the just logistics and finances of treating a horse with EHM, with the neurologic version of herpes virus, is restrictive, and it's just not a possibility for owners. So a lot of those horses get euthanized. Prevention is really, really important. So there is a vaccine for this. The vaccination reduces shedding, so it definitely helps with spread of this virus. Monitoring temperatures, so taking horses' temperatures if there's been a possible exposure, is really, really important. Seeing as soon as it spikes up, as soon as a horse becomes febrile, has a fever, or is sick at all, they should be isolated immediately. Equipment should be disinfected. And any new arrivals or any horses who have left some type of group facility or show or competition should be isolated when they go back to their farm. So right now, if you hadn't heard, there is an outbreak of herpes virus, equine herpes virus 1, with cases of EHM, the neurologic version, being reported. So this really started hitting the news in November. There was a major event in Waco, Texas, the WPRA World Finals and Elite Barrel Race competition. There, as far as I know, I try to gather data. It's kind of moving data, but 44 confirmed cases were tied to that event. So if you're not in the horse world, let me explain something to you. When we talk about big stage or just large equine horse competitive events, you will have people that come to those events from all over. They load their horses up in a trailer and they drive to those events from all over the country. And so when you have an outbreak situation of a virus like this, what happens is all these horses and all these riders and trainers, they come together in this event for 2, 3, 5 days, whatever. They're in close quarters. Temporary stalls have been put up. Horses are in stalls next to horses they've never seen before. And so once you have an outbreak situation where it just takes one horse to have this virus and be actively shedding it, and passes it on to other horses in that area, what happens is a lot of times they don't get sick while they're still there, right? Because the incubation period can be a few days. So they get infected while they're at this event, and then they all get back in their trailers and they drive home all over the country, and they take that virus, if they've been infected, back to their home farm or ranch or whatever boarding facility, and then they spread it around. And so this is why equine and even cattle outbreaks can really spread fast, because horses especially, you have movement of horses all over the country all the time. And so that's how this originally started, we think. There have been at least 30 of the neurologic version confirmed in Texas. There are deaths being reported. There are dozens of barns under quarantine. And like I said, many horses that were exposed traveled before they were showing any symptoms. So this outbreak is growing. There are a lot of equine events going on in the world right now. The NFR is happening. National Rodeo is happening right now. And so there's some controversy around that. Some people feel like it should have been canceled this year because of the outbreak, but it was not. And I don't really have a strong opinion about that. I'm not in that world that so much anymore. But what I will tell you is that this is serious because it can be devastating for horses and barns and breeding facilities and just people who have horses. And it definitely can be deadly and it can be very, very costly. And so we want to do everything we can to stop the spread. So if you have horses, I would highly consider refraining from traveling with them right now, especially to places where they're going to be exposed to other horses. I would absolutely quarantine my horses when I got back from any kind of group event where I was around other horses for at least a week, probably a couple of weeks, if that's possible at your farm. I would be monitoring any horses that have traveled. If I saw any signs of disease, I would get a vet to look at them right away. I would be monitoring temperatures, and we just all can do our part to be responsible. So, if we have illness, keeping those horses home, reporting it, calling our veterinarians, getting them treated, and isolating appropriately. So that's what's going on if you've heard about the equine herpesvirus outbreak. So if you didn't know, there's another viral outbreak going on in the US, and this is in dogs, and this is Parvovirus. And most of you have heard of Parvovirus, but we're going to talk about it just in case you haven't. It's very important that we talk about Parvovirus because Parvo is an extremely deadly disease in dogs. In the 1970s, a little bit of history of Parvo. It's a highly contagious virus. It attacks rapidly dividing cells, and so it loves to attack the GI system. It attacks the intestines. It causes very, very horrible disease in dogs. It affects young dogs most commonly because their immune system is the most naive. So we see this in puppies most commonly. And in the 1970s in the United States, there was a huge canine parvovirus outbreak, like epidemic. And I don't know, I was looking the other day, like millions of dogs probably died from parvo in the 1970s. The parvo vaccination was created in response to that major outbreak in the 70s. And rates of parvo dramatically decreased once a vaccine was created and produced. It's a very effective vaccine. And so we still see parvo all the time now. A lot of that's just because, well, there are various reasons for that. It's a very, very hardy virus. It is very persistent. It is tough and stubborn. It's hard to kill. It's hard to get rid of. It just hangs around an environment. And so it's one that lives on. So we still see parvo all the time. And in some places in the US, we are seeing an uptick and we think outbreak level infection with parvo. So that's what we're going to talk about a little bit today. So like I said, puppies between 6 weeks and 6 months of age are the most vulnerable to parvovirus. Again, this is just because their immune system is the most naive. Parvo infects dogs usually via ingestion. So dogs ingest just a tiny particle of the virus from all different things. So contaminated feces, soil, kennels, any kind of fomite. So fomite is just something that harbors a virus. So like I said, parvo is extremely persistent, hardy. So it can be on any kind of surface. It can be on hard surfaces, soft surfaces. So any shared bowls, any particles of the virus on the ground, in feces, it's everywhere. So once that viral particles are ingested, it replicates in the body, it spreads into the bloodstream and gets to the intestines. So it attacks the small intestines and the intestinal crypt cells. And this causes basically a collapse in the GI barrier. So inside the small intestine, there are multiple levels of tissue or layers of tissue that have all different, very important functions. They keep poop in the intestine. They keep the material that's in the intestine in it. They allow for absorption of nutrients from the ingesta that's moving through the intestines and becoming stool. And if the crypt cells are affected and the intestinal barrier is compromised, a lot of really bad things can happen. So that's where parvo goes. And it does a very, very good job of damaging the intestine and causing really severe disease. It also can cause bone marrow suppression, which means that these dogs, not only is a virus attacking their GI system, they're also often not able to produce as many white blood cells for protection as they would like to or need to. And so this is what makes these dogs so susceptible to becoming septic, where they get actual bacterial infection that goes into their bloodstream and they get very systemically ill. They go septic, which is very, very deadly. So puppies or dogs that have parvo, here's what they look like. They are lethargic. They have profuse vomiting, bloody or watery or both diarrhea. They get dehydrated really fast. They sometimes have a fever at first, but then as they get more sick and if they become septic, their fever can get, or their temperature can actually get low. They'll be very, very lethargic. They can collapse. Often people talk about parvo having a smell. And so parvo diarrhea does have a smell. A lot of that is just contributed to the blood that's in their stool and also some of the lining of their intestine that's being attacked and getting necrotic and like shedding out through their stool. It is the most disgusting disease, like for everyone involved. These dogs are just pouring diarrhea out of this, just like seeping out of them. It's terrible. They're vomiting, they're miserable, and they're puppies usually. And so it is just the most pitiful thing you could possibly imagine. It is extremely contagious. Like I said, it's a hardy virus. It can survive for months to years in the environment. And it requires a very small amount of this virus to initiate infection. So these dogs get really, really sick really, really fast. With treatment, their prognosis can be okay with intense treatment. That is expensive. We don't have an antiviral cure specifically, but we have a new treatment that's a monoclonal antibody that is working really well. So we're going to talk about that. I guess that is sort of like an antiviral cure. But so a treatment mainly consists of supportive care. So IV fluids, often aggressive IV fluids we have to do to keep up with the rapid dehydration that happens. We give these dogs antiemetics. So Cerenia is one that's commonly used, meropitant citrate to keep them from vomiting, to help control that, to stop the dehydration or prevent or treat dehydration. We will give them anti-nausea medications like ondansetron. These dogs can be very painful. Their gut can hurt. And so sometimes they need pain meds for that. We will often give them broad spectrum antibiotics because their intestine is so compromised. We can have translocation of bacteria from inside the intestine into the abdomen and the bloodstream, like I said. And so antibiotics can help with that, cover that. Our IV fluids are going to help control our electrolytes and keep those in check. And some of these dogs get really hypoproteinemic. So their protein levels get really low. They can lose a lot of blood. They can become anemic because of this. And so some of these dogs require plasma transfusion, colloid fluid therapy. They just need a lot of support to just survive the virus. These dogs also need to be strictly isolated in clinics when they're being treated for parvo. So that's very, very costly because, like I said, in the horses with the herpesvirus, there's just a lot of effort that goes into treating isolated patients. Studies show that survival with aggressive early treatment can be as high as 80 to 90%, which is the great news, but that can be very, very expensive. You can spend $10,000 on treating a parvo puppy really, really fast. And that's just because of the medications and very intense nursing care and equipment that's needed to treat them. Untreated mortality rate in parvo dogs is really, really high. So a lot of dogs, if they can't get treatment, will die. It's very devastating. We will see whole litters of puppies get infected with parvovirus and they all die. I've dealt with that as a vet in other places that I've worked. I don't see a ton of parvo where I work right now, but I fear that is changing. So we'll talk about that in a minute. So we do have a huge update in parvo treatment and management that's just come around in the last few years, and that is a conditionally FDA approved biologic, which is a monoclonal antibody for parvovirus. It is a one-time treatment that can be given in a hospital or a clinic to a dog that's been diagnosed with parvo. It's very cool. So it's laboratory developed antibodies that are administered to the dog, and they just know exactly what to do. They go directly to the parvo, they bind and neutralize the virus they can in the bloodstream. So instead of the puppy's immune system being the only line of defense, this is an added line of defense and treatment for it. And so this is like immediate targeted antiviral action. So it's like a huge deal, especially with what's going on right now. The problem is that it's expensive, especially if we talk about a bigger dog. So it works really, really well. These dogs have a huge drop in their viral load pretty quickly, so they don't get as sick, especially if it's given early on. And they can often be treated outpatient if they've gotten this early on. They don't have to stay hospitalized in isolation, and the actual integrity of their intestine can be maintained or preserved with this treatment. But again, it needs to be given to work best as early as possible, and it isn't cheap. So we're hoping that the cost of that treatment goes down over time. But for right now, it's definitely a lifesaver. We had a coworker with a puppy with parvo recently, and he got it, and he's doing great. So it decreases the severity of their clinical signs, it shortens hospitalization times, and greatly increases our survival rates. So great news. If you haven't heard of it, it's very exciting. A lot of people in the vet world talk about how they're so glad to have it. ER vets, especially my friend Dr. Tanasia Crocker, loves the parvo monoclonal antibody treatment, and she has it in her GP practice, but she also works in ER as well. And again, we give it right away once we've diagnosed parvo. We can diagnose parvo in the clinic with a SNAP test. It's very easy. We use a swab to get fecal and oral samples, and then we can get a positive SNAP test to that within just a few minutes. So yeah, what's going on with parvo? Why are we talking about parvo? It's been around for a long time. So if you didn't know, we have vaccines that work really well to prevent parvovirus. Unfortunately, we are seeing some outbreak hotspots in the US. One I know about a lot is in Arizona. I have several friends who practice veterinary medicine in Arizona, and they are seeing a ton of parvo. There's just widespread outbreak there. Just ERs, hospitals are overrun with parvo cases. And we are hearing about shelters in Texas having parvo outbreak situations, and more states are reporting an uptick in these situations. Lots of shelters deal with parvo outbreaks just because of the nature of what they're doing. They're taking in sometimes whole litters of dogs that are not protected from it, not vaccinated, and sometimes come into the shelter already infected with the virus. There are a lot of reasons why we are seeing an increase in parvo cases. One of them is the shelter crisis that we're experiencing. We have shelter overcrowding all over, and that just lends itself to disease. And parvo is just so very contagious and devastating. It's one that's always going to rear its ugly head when we get in that situation. We are seeing lower vaccination rates in the US for parvo. It's very sad. The parvovirus or the parvo vaccine is, like I said, it's very effective and efficient. It does a really good job. A lot of people are choosing not to vaccinate at all because they've been scared or told misinformation that vaccines are bad for their dogs. And so they just think their dogs don't need them or that it's not worth it. One reason dogs are not being vaccinated is financial concerns, which is really difficult and sad to hear. Some people just are having a hard time affording groceries, and so they can't afford veterinary care either. And so a lot of puppies and a lot of mama dogs are not getting vaccinated the way they should be. We do see, as time goes on, we see more and more movement of dogs across states. Some of this has to do with the way rescues and shelters try to mitigate the crisis that we're in with all of the overcrowding. And so they will transport dogs from one area to the other to get them adopted out. And while that helps with our population issue, it can lead to the spread of diseases, sort of like in horses when we move dogs from one place to the other. Because parvo is so hardy and persistent in environments, that's another reason why it lends itself to outbreak situations. It's really hard to kill it. You need bleach to kill parvo. A lot of disinfectants will not neutralize parvo. And so cleanliness and sanitation protocols are so important in places where parvo is being seen like this. And then in Arizona specifically, where we're hearing about a lot of parvo outbreaks, it is a unique place because it is a warm climate. And so the virus will absolutely persist year round. There's a lot more dogs that are out and about all the time. There's a high stray population in Arizona and a lot of dog park use because the weather is kind of nice all year long. And so you're just going to see it more in places like that. My friend Dr. Deer is an ER doctor in Arizona, and she has talked about this a good bit. If you haven't, you should check out her page. She talks in more detail about these things, but she's definitely talking about how they're seeing so much of it. So, parvo it's horrible. It's devastating and it's hard to watch. It's expensive to treat. A lot of people cannot afford to treat parvo. So a lot of parvo puppies get euthanized if they're not doing better with outpatient treatment. And so we want to do everything we can to prevent these outbreaks from happening. And the best way we can do that is to just keep talking about vaccination and talking about spay and neuter so that we don't have these multiple litters of unvaccinated puppies and unvaccinated mama dogs. And spay neuter can help prevent that as well. Spay neuter can help with our shelter situation. And so we won't have overcrowding and we'll have less of these outbreak situations. So if you ever have a dog who has not been vaccinated for parvo, they did not get all of their puppy shots for parvo, or they're overdue for parvo vaccines and they have GI disease, it's always a concern, especially in these young dogs. We definitely see a lot of parvo cases where someone brought their puppy into the vet. They got like the first round of puppy vaccines, maybe even the second round of puppy vaccines, but they just never finished the series. And the reason we recommend the things that we do is because they work. And so if a puppy hasn't gotten their full series of puppy shots, that can leave them vulnerable to developing that disease. And we do see that a lot. Puppies with incomplete puppy vaccinations can develop parvo. I've talked about this a little bit, but if you didn't know, puppies should get a distemper parvo combo vaccine, DHPP or DA2PP, we call it. They should get that vaccine starting around like 6 to 8 weeks. There is some protective immunity from mom if mom was a vaccinated dog until about 8 weeks for things like parvo and distemper. Which is why we try to start vaccinating them by around 8 weeks. And then typically we want to vaccinate puppies for that, including parvo, at around 8 weeks. And then I typically do every 4 weeks or so. So 8 weeks, 12 weeks, and 16 weeks. And that series of puppy shots gets us our full protection. Studies and science tell us that. And then we don't have to booster it again for a year after that final puppy shot. And when I give that 1-year booster after the final puppy shot, then that becomes a 3-year vaccine. It's good for 3 years. And then we just do that every 3 years. That's following AHA vaccination guidelines. And it's really what all veterinarians should be following. So no, you shouldn't need to vaccinate your dog for parvo, your adult dog, every year. That is not what science says is necessary. So I agree with people that say we shouldn't be vaccinating dogs for distemper parvo every year. No, we shouldn't, but we should be vaccinating them as puppies appropriately, boostering that a year later, and then doing it every 3 years after that. So just to clear up any questions about how we should be vaccinating for it, but that's how we prevent it. So I hope this was helpful. I don't know if you've heard about these things in the news. We will be watching both situations, and if I have more solid numbers, facts, updates to give you, I will do that. And if you're not following us, make sure you are. Dr. Molly Says Pod on social media. If you're listening, you can watch this on YouTube. And if you're watching, you can also listen and subscribe wherever you listen to podcasts. And if you have any questions, specific questions, let me know. You can send me a DM. And we will see you next week on the Dr. Molly Says podcast.